Hi, and welcome to Healing Peak Regenerative Medicine's longevity channel. I'm Dr. Nixon, and I just kind of wanted to start taking this time to process my thoughts on all of this as the pandemic continues, and as everything continues to come out about who this disease or infection affects and how it affects these people, and why are there more at-risk populations and less at-risk populations. I wanted to record some of my thoughts on this as a naturopathic doctor, and why I think it's more important now than ever that you have a naturopath on your healthcare team. A lot of our therapies and things that we've been recommending since the beginning of naturopathic medicine are on the list of things that are helpful in fighting off COVID-19 and also helpful to prevent getting it. And it's really amazing that that's all happening. And what I'm realizing is how many people don't know about naturopathic doctors, don't really understand what it is that we do. And especially where I practice in South Seattle, which isn't really far outside the Seattle city area, most of my patients have never seen a naturopath before they come to see me. And so I just really wanted to start describing what it is we do, why it's so effective, why it's different than your other healthcare providers, and maybe what you're not getting from your regular primary care doctor that you could get from a naturopath. And they can work together. It is important to find a healthcare team that can be cohesive and understanding of your choices and all work together. So a lot of the at-risk population outside of age has a lot to do with what we're calling comorbidities, and that is another disease in the body that's sort of pre-existing, like diabetes, heart conditions, high cholesterol, history of smoking, history of lung issues such as asthma. All these things are considered comorbidities, and a lot of them are prevented. You can prevent them from happening, or you can reverse them in your body, or you can stop them from progressing. And that's really where naturopathic medicine shines, is helping patients navigate this type of chronic condition and putting you on natural things to help your body actually function in a more optimal way, which means reversal of disease in some cases, not all, and it means overall long-term health, or health for longer periods of time, or your entire life, higher quality of life, usually less medication use over time, and prevention of these chronic issues from getting worse. A lot of times what happens is, the conventional medical model puts everyone into categories, and this is very effective in treating lots of people very quickly. And I won't get into it in this video, but that's what conventional medicine has sort of been forced to do, because insurance companies are paying medical doctors less and less and less. And so in order to continue to, the big conglomerates, in order to meet their bottom line, they need to see people much more quickly. And obviously free market and pharmaceuticals. And there's a lot of stuff to go into on the bureaucratic side of medicine, but I don't, that's for another day. So what I wanted to really focus on, or what I'm going to focus on, is that type 2 diabetes is by and large a preventable condition, and that's really being targeted by COVID-19, and high blood pressure as well, for different reasons, which is, some of these things we've been told, oh, well, my mom or my dad had that, so it must be genetic, or my whole family has this issue, so it must be genetic. And that is certainly a great point, and you could be more predisposed to these conditions. But even the most, highly genetic mutations that cause an increased risk for these issues can be managed with diet and lifestyle to a pretty high degree, allowing for less use of medication in those in that small population of people. But most likely, even though your parents had it or your grandparents, it could have also just been related to their diet and lifestyle and, poor health habits, or the wrong diet for them, or the wrong exercise program for them. And so I just really wanted to start to get the message out there that you don't have to be a victim to the chronic issues that you have, and there is other answers out there, there is other information out there, and changing some basic therapeutic guidelines, meaning poor sleep habits. I'm just going to throw out a bunch of examples here. Poor sleep habits or waking up multiple times at night cause elevated cortisol levels, and insulin and cortisol are related in the body. And so if you're having high cortisol levels at nighttime and the body is under stress, then insulin is going to be increased in the bloodstream, and then that will predispose you to prediabetes and blood pressure issues and cardiovascular problems. And so just by getting much better sleep, you can already decrease your risk of these blood sugar control problems and cardiovascular problems. That's just one piece. The other piece is how our bodies are, built to metabolize carbohydrates and protein and plant-based food, veggies, fruits, and so on. And by making some, simple modifications to your diet, and I don't mean simple in that they are easy to do, but, I think that they are fairly straightforward in what needs to happen to start regulating blood sugars more effectively and decreasing overall inflammation. And we'll kind of get to inflammation in a minute. But there's some really, if you can get some better sleep, and then you can start to make some better diet choices, and an exercise program that utilizes hormones correctly, and that doesn't spike cortisol levels in a way that's not healthy for you, especially if you're under a lot of chronic stress. Getting the right exercise program can make massive differences in blood sugar and how you sleep and hormone balance, which then all of that will decrease your risk factors, and also decrease the chance that you will get one of these other comorbidities like type 2 diabetes or high blood pressure. You can then reduce it as well. You can balance your blood sugars more effectively and really help improve your immune function. And that's really with COVID-19, what we're seeing is that it's an issue with immune function, and the people who are not having as many symptoms are very healthy people. And I don't know that there actually is a lot of access to naturopathic doctors, true naturopathic doctors that have a medical degree. There are a lot of people out there that call themselves naturopaths that aren't actually true naturopathic doctors. And so finding one in your area, Googling naturopathic doctors near me. We do also have the ability to do telehealth with a couple of restrictions legally, but those are fairly easy to overcome. And there's a lot of ways to get in touch with somebody who has a medical degree, who is a naturopath, that could really help you, prevent getting sick. And I'm not just talking about COVID-19 at this point. This virus is really just illuminating how unhealthy our general population is. And I think we need to ask the bigger question of why is that happening, and how do we prevent it from happening again, and how do we keep our population as healthy as possible. And, I think that there's a time and a place for prescription medications. I do think that they save lives, but I also feel like they're fairly dramatically overprescribed when, sleep, diet, lifestyle, all these things can make such dramatic changes on people's health. And then, we wouldn't be faced with such an enormous crisis at this point, because the population as a whole would be so much more healthy. And so that's kind of what I just wanted to touch on today. And these are just my thoughts as this whole situation with this pandemic develops, and things that they're second nature to me, but as I am sharing some of my thoughts with patients and friends, it is obvious to me that it is not obvious to everyone, some of these things that I think about. And so I just kind of wanted to take these opportunities in the next couple of weeks as things go on to share my thoughts as a naturopathic doctor during this crisis. And I would love for you to share my videos for people who you think they could help, or people who you think need to hear some of these things, people who maybe don't know about naturopathic medicine, but you would love for them to know more about it. These are all really great people to share my video with, and you can comment in the boxes below if you have questions about anything. And if you would like to schedule an appointment with us remotely, then our office phone number is 206-899-6000. Thanks so much for joining us.